Yesterday we have discussed in detail about testes, scrotum, but in a nutshell, if I explain for you guys, we are having internal genitalia, external genitalia. So these are external genitalia having testes, having three layers. Pneumonia क्या है? Wave, VAV, tunica vaginalis, tunica albuginea, tunica vesiculosa. This is the outermost layer. Tunica vaginalis having two subdivisions, inner layer and outer layer. In between these two layers we have a cavity. This is the most dependable part. When someone is having injury और कोई गेंद लग गई आपको इधर, there will be accumulation of fluid in this part. We have a hydrocele. और कल हमने बोला था कि hydrocele तक पहुंचने के लिए आपको कितनी लेयर से गुजरना होगा आपकी नीडल को. Then tunica central part is albuginea, covering your middle part of your testes, having septum. In between septum we are having lobules. Okay, we will not go in detail. 200, 300. Seminiferous tubule 60 centimeter in length, 0.2 millimeter in diameter. Okay, and we calculated the length of seminiferous tubule is 54,000 centimeter, right? And in this we have Sertoli cells, the Leydig cell responsible for testosterone and spermatogenesis. We will go to the lady testis, passing through the straight lobules, then enter into the epididymis coma-shaped structure, which is 20 feet in length or 5 meter in length. By different they are 12 to 30 in number. Now we are head, body and tail. From there we have ductus difference, which will pass upward to the spermatic cord. Length of this ductus difference is 45 centimeter, and we have 4 courses of the ductus difference we have discussed. And then we have 5 layers of the scrotum. Outermost layer is skin. Then the secondmost layer is dartus, required for the wrinkles of the testes, and upward of the scrotum to the testes. Then third one is external spermatic fascia. Then we have cremaster muscle, responsible for elevation of the testes. And we are having cremaster reflex, positive or negative, depend upon the cremaster reflex. Then last but not the least, we have internal spermatic fascia. So these 5 are the covering of the testes. So most important thing, this is the third outermost layer of our testes, right? This is present on the anterior part of the testes. I'll do like this. So you can see these are only present in the anterior side. It is not present in the posterior side. It is absent in the posterior side. This is very serous membrane, very thin membrane. But tunica albuginea is most fibrous layer, most thick layer of the testes. Passing to spermatic cord. Spermatic cord is nothing, just an outpoaching or extension of abdominal wall. It acts as a conduit, bridge between abdominal content and the scrotal content. Bridge के तौर पे काम करता है. Why it is having content क्या है इसका? People don't cooperate to a good student's life. Or the rule of 3. We are having Paciniform plexus, ductus deferens, cremaster muscle, testicular artery, lymph nodes, sympathetic nerves, or genitofemoral nerve, or artery to the ductus deferens. This is the content present or passing through this spermatic cord. Then we have rule of 3, like 3 nerves, 3 arteries, 3 fascia, 3 things are also passing through. मैं एक्सप्लेन कर दूँ एक सही है, क्लियर है. Okay. Then left spermatic cord is longer than the right. That is why left in scrotum we have discussed about the median ridge or scrotum raphe. From the both sides of the scrotum, the fiber, the aponeurosis, they will join together. And we have a line starting from the glans penis, from the frenulum, but most importantly from the scrotum to the anus canal. हमारी ridge नजर आती है. It is most prominent part, impression. And due to left testicular vein, it will drain to the left renal vein. That is why the left varicocele is most common than the right. And क्योंकि right वाली जो है वो सीधी, जो right testicular vein है वो सीधी inferior vena के में चली जाती है, लेकिन जो left वाली पहले left renal vein में जाती है, फिर वो इधर आती है. We have a connection. तो जब भी प्रेशर बढ़ता है रेनल वेन में, इसका प्रेशर भी बढ़ जाता है. जब वहाँ पे ऑब्स्ट्रक्शन होती है, ये भी ऑब्स्ट्रक्ट हो जाती है. जब कॉन्स्टिपेशन देयर इज ड्यू टू स्मॉल dilatation of the sigmoid cord, there is a compression of the renal left testicular vein. So we have a varicocele. आपकी जो veins है वो फूल जाती है. Then scrotum we just talked about edema, more dependable part. Then species gland obstruction, then tumor or gonorrhea infection like sexually transmitted disease and pyogenic infections. Then okay, I'm not talking about this thing. 3 tools we have. After this scrotum, we have discussed about descent of testes. Yesterday we also discussed these 4 parts. Penis. This is the external genitalia of the male, responsible for urination and copulation. That's it. So we are having the average worldwide length of the penis is 3 to 5 inches, and it all depend upon your genes, like size of your hand, size of your foot. You can't increase your size with diet or with any kind of supplements or exercise. Am I right? Because it all depend on your genes. So size of your penis also depend on genes. But unfortunately, due to malpractice of the doctors and hakims, we are having increased number of penis lengthening surgeries. हम जो बूढ़े वाले पेशेंट्स को कहते हैं कि तुम्हारी जो इम्पोर्टेंस की काज है ये साइज की वजह है, तो वो बेचारा सर्जरी करवाता रहता है. दैट इज एब्सोल्युटली एब्सर्ड और नॉट अलाउड. malpractice में आता है, बहुत बुरी बात है. Okay, then there are two parts of the penis, base or fixed part or radix. Then we have free or pendular part. Fixed part is attached with the two crura and one bulbus, and starting from the pubic arch, and then we have free part or pendular part. In pendular part we have two erectile tissue present posterolaterally called corpora cavernosa, and one anteriorly or ventrally we have corpus spongiosum. In between this corpus spongiosum we have urethral opening, or you can say your urethra, penile urethra present in the corpus spongiosum, and these tissues are required for the erection of the penis for the copulation. Okay, and this, don't think like this, okay, nature why gave this part penis because we are going to use this penis for copulation after marriage ना, तो 20 साल तक क्यों हम इसको यूज करते हैं. This is also important when someone is having hypospadias. What is hypospadias or epispadias? When there is urethral opening just above the penis or below the penis, not at the glans penis. So you are not using whole penis. Am I right? So due to that your penis will not get the length, and it is also one of the cause of impotency. लेकिन जैसे आप यूज़ कर रहे हैं फॉर द यूरिनेशन, आपका पूरा जो यूरिथ्रा है वो पूरा जो पीनस है वो यूज़ हो रहा है, वहाँ से यूरिन बाहर आ रहा है. सो इट इज़ आल्सो मेंटेनिंग द credibility of the penis. इसकी बता के लिए भी ज़रूरी है. Then it will be helpful for you after marriage for the erection of the penis. Then we have discussed about this cross section. If we cut the penis, we can see we have two corpora cavernosa and one corpus spongiosum. This is posterolateral, this is ventrally. In between that we have cavernous arteries. And the space present between this corpora cavernosa is responsible for the erection of the penis. When there is increased blood supply, there will be increased erection of these tissues, and there will be compression of the vein. There is no venous drainage, and your penis will stay erected for a longer period of time. And this is the urethral opening in the corpus spongiosum. At the end, it starts from the base till the glans penis, but this is making your glans penis, corpus spongiosum. This is the most erectile, not most, always erectile tissue in your body while you are sitting, walking, talking, sleeping, bathing or doing whatever you are doing. It will always stay erected. It's only erectile tissue. बाकी जो है आपके corpora cavernosa वो erect होंगे जब जरूरत पड़ेगी. And this is most sensitive part due to enormous amount of nervous supply. Let's discuss about scrotal blood supply. It is having pudendal arteries, internal and external pudendal arteries, and nervous by nerves, sacral plexus and lumbar plexus. If we talk about testicular blood supply, testicular artery and testicular veins plus pampiniform veins. Then anything else? Then we have discussed about Buck's fascia. That is most important when you are having urethral injury, but Buck's fascia is intact. There will be accumulation of the urine and the blood inside in between the Buck's fascia and the three erectile tissues. Na? This is called sleeve hematoma. It is also in a straddle injury, in the bulbous urethral injury. But if someone is having enormous or severe kind of injury that will disrupt or injure this Buck's fascia also, then what will happen? The urine and blood will enter into your scrotum, to your thighs also, to your pelvis. So it looks like a butterfly. So it's called butterfly hematoma. Okay. Okay. कुछ और है क्या? Okay. Thank you so much. अभी हम बाद में